Imagine a world where deadly disease such as measles and polio and a whopping cough make a comeback, spreading rapidly through children and schools. This nightmare scenario would become a real-life scenario if action is not taken and children do not get vaccinated before enrolling in school. Mandatory vaccination is something that's been long debated. However, vaccination is one of the most effective public health interventions in the world for saving lives and promoting good health. Vaccinations are something that will prevent diseases in kids and protect our society, and it should be a regulated law for parents to have their children be vaccinated. In an article by EdSource, statistics have proven that Los Angeles Unified, the state's largest district, had 91.9% of its students fully vaccinated as of August 24th. In this district with 430,000 students, that means more than 30,000 students were not vaccinated. This goes to show how many people are unvaccinated and the dangers that has through spreading through Los Angeles district with unaware people that are unvaccinated. The audience should care about this and want to learn about this topic because vaccination not only protects the individual but contributes to community immunity. This means when a high percentage of the population is vaccinated, it is more difficult for diseases to spread. Overall, vaccinating children for school is essential for protecting their health, preventing outbreaks, and fulfilling our responsibility to public and community health well-being. It also affects our society as a whole, and for more people who are more vaccinated, that puts a higher chance to be a limited possible virus outbreak. Now that we can understand the importance of vaccination and its effect on our society in a positive way, we can first go into seeing why parents should have their children be vaccinated before school and why it's so important. Vaccination is not only a possible personal choice, but it also is a public health responsibility. By vaccinating their children, parents contribute to the overall health and well-being of their communities. It can prevent death and sickness of many lives. For that, statistics show that 4 million deaths worldwide were prevented in childhood vaccination every year. More than 50 million deaths can be prevented through immunization between 2021 and 2030. It is estimated that measles vaccination also can save nearly 19 million lives. By looking at those statistics, we can see how much of a difference vaccination can make overall in the progresses of these years and how much of a difference it is making currently in this time right now. Children in the U.S. still get vaccinated in the preventable diseases also. In fact, we have been seeing resurgences of measles and whopping cough over the past few years. Since 2010, there has been 10,000 to 50,000 cases of a whopping cough each year in the United States, and about 10 to 20 babies, many of whom were too young to be fully vaccinated, died each year. While some babies are too young to be protected by vaccination, others may not receive certain vaccinations due to severe allergies, weakened immune systems, and causes like conditions such as leukemia or other reasons. To keep these babies safe, it is important for children and their parents to know that they are able to get fully vaccinated if they are immunized. Immunity is the body's way of preventing disease. Because of a baby's immune system not being fully developed at birth, babies face a greater risk of being infected and getting seriously ill, which vaccines help to teach the immune system to learn how to defend amongst these germs. After examining how much of prevention vaccination makes for sickness and death, we can take a look at the statistics of vaccination for children among COVID. Statistics show that COVID ranked 8th among all of the causes of death among children and young people from 19 to 0 years old, from August 2021 to July 2023. This shows the importance of vaccination and how much of a difference it can make through being vaccinated during COVID. Obviously, it could have not prevented COVID from happening, but it prevented the disease, which would have brought the rates down, especially among young children. Vaccination not only reduces the risk of short and long-term health complications from COVID, but it also shows the spread of disease by preventing it from being passed on to others from high risk, such as elderly people and people who work in the medical staff conditions. For decades, vaccination for infectious disease have been recommended for children and are a mandatory public health measure in many schools. Parents who are vocal and enthusiastic about the children getting vaccines encourage others in their community to do so as well. A study done by Kaiser Foundation found that 5 parents will immediately vaccinate their kids under the age of 5, which will protect other family members, friends, and school/staff facility. Vaccines have reduced and in some cases eliminated many diseases that killed severely disabled people just a few generations ago. Overall, advocating for parents to have their children be vaccinated is very important. Your children do not need to go and get vaccinated right away because obviously their immune system needs to build up, but it is so important to be able to advocate for vaccination and to bring awareness to the importance of how vaccines can make a difference in our society. Vaccination is one of the world's most successful public health interventions for saving lives, like I said in the beginning, and vaccinations are something that can prevent infections in children and protect our society. It should be a legal requirement for parents to have their children be vaccinated before they start school. Overall, starting to be an advocate for vaccination and being able to show that vaccination can help bring immunization and bring help to this would be important to show how critically important it is for several reasons, as I discussed in my speech. Vaccines protect children from serious and potentially dead diseases. Vaccination is one of the most effective ways to prevent spread of infection disease and protect public health. Vaccination overall helps children, and the maintaining immunization records are essential for protecting individual health, preventing the spread of disease, and promoting the health of well-being of communities. Thank you for watching.